Which of the following medications is most likely to provide symptomatic relief for the patient? Okay. A 38-year-old man presents to the dermatologist with complaints of pruritic, purplish, flat-top papules in his extremities. He also reports pain and difficulty swallowing and has noticed white streaks in his oral mucosa. A skin biopsy is performed which shows band-like lymphocytic infiltrate at the dermoepidermal junction and colloid bodies. Which of the following medications is most likely to provide symptomatic relief for this patient? I should know I know what this is called. It's called lichen planus. That's what it's
There
called.
we go. Good. Bingo. Right.
Um,
Diagnosis first. So you committed. Now what do you want to do?
lichen planus. I always, and so I've learned this just from like doing these questions, is that oral is for like severe symptoms and topical is more like calm symptoms. And so this does seem, in my opinion, I don't know if it's actually the whole thing is he also reports pain and difficulty swallowing and white streaks. And so it seems more systemic, in my opinion. Ooh, there's also systemic corticosteroids. Well, it wouldn't be antihistamines. It wouldn't, in my opinion, it could. Calcineurin and immunosuppressive are kind of the same thing, in my opinion. So I would get rid of it's between topical and systemic, and I would, man, this is gonna bite me. I'm gonna go with systemic just because of the fact that he has pain and swallowing issues and he has oral mucosa
Okay.
issues. So I would go with systemic.
Okay.
Knew it.
No, that's okay. That's okay. So, I am kind of like, so it seems like topical is going to be first line treatment for symptomatic release, right? So a couple things that I'm thinking of, right? So,
Oh, symptomatic.
first of all, I always think what's his chief complaint? It's really that he's itchy on his extremities, right?
Yeah,
So
yeah.
you want to treat that first with kind of topical. I do have to say that this question might be a little bit, on a step two standpoint. It's kind of on teeter, right? I mean, I can see it as a step one question, but maybe a little bit more on a step two question here. But yeah, so pain and difficulty swallowing, white streaks on his oral mucosa. So they're just giving you, okay, the diagnosis is lichen planus, right? And they did a biopsy that even proves it more as lichen planus. But if you're talking about like itchiness, skin, things like that, you want to try topical steroids. Also, on top of that, you can do topical steroids also in the mouth too, right? Like if you have like a oral gel base for inside the mouth, or sometimes people even do like swallowing like thick viscous steroids, right, to
Yeah,
coat the
I
esophagus.
never knew that you really could do that. I always thought it would be an issue that you did swallow it like too much.
No, if you think about systemic steroids, it's going to be, in a sense, right, the same
Oh yeah,
thing,
you just
only in
swallow it.
pill, right? You swallow it. You know what I'm trying to say? So, yeah, I think this one's tricky for sure. I think that you got the diagnosis right. I don't know if they'll ask you topical versus systemic steroids on your step one. That seems a little bit unfair. But remember, these things, some of these questions are really meant to take you to the next level, so that if you do know the next level, then there's really no way that you miss a level below. You know what I'm trying to say?
Hmm.
So if they ask you, oh, they give you this,
What's the
disease process.
diagnosis?
Yeah, what's the diagnosis? Then you can't miss it. Or, hey, how do you want to treat it? And they're only giving you one type of steroids, then you're never going to miss it, right? Because you know the difference between topical and systemic. So,
For sure, for sure.
all right.